Greetings, YouTube. I want you to imagine that you're building a house. 3 days into the construction process, you discover that there's a problem with the foundation. Now, 3 days in, that's a pain. It's going to be expensive to fix it, but 3 days in, it's a manageable problem. You haven't gotten to the point where it becomes a major issue. But if you discover there's a problem with the foundation on day 93, well, that's a major issue. The earlier you can find a problem in a process, any process, the better off you are. Another example would be healthcare. Your health is important. The earlier you can discover a problem, the better chance you have of mitigating it, recovering from it, and doing so cheaply. If you find out at the last minute while they're shoving you into an ambulance and rushing you off to the emergency room, it's probably too late. You can't really mitigate that issue. But if you discover at a routine medical exam that you have some kind of, say, slightly elevated blood pressure, they can do something about that. Diet change, exercise, two things I advocate, and the proper kinds of medication. I take a blood pressure medication, though I may be asking to come off of it. And the earlier in the process you find the problem, the better off you are. This is why I am an advocate of the universal healthcare system, a single-payer system where everyone would have access to annual exams, to visits to the dentist, and to eye exams every 2 years. A comprehensive healthcare system that would actually save us billions of dollars because we would be able to find problems when they are small and manageable and not when they are huge and potentially fatal. Why do I bring this up? Well, I've brought it up many times before, and I can guarantee you until we have a single-payer health system, I will bring it up again. I'm bringing it up today because there was an article I read the other day concerning the GOP's stance on healthcare. And their stance essentially is, if you're sick, go to the emergency room. That's not a solution to healthcare problems. That's not even a band-aid for healthcare problems. That is the absolute worst advice you can get. That is the most radically dumb concept I have heard of when it comes to healthcare. And there are conditions that don't ever result in going to the emergency room that still need to be dealt with. For example, depression. All right? And going to the emergency room is hugely expensive. If you have insurance, it's hugely expensive. If you don't have insurance, say you're one of the 30 million Americans that don't have any, going to the emergency room is a financially crippling event. And if you can't pay it, guess who does pay for it? The rest of us, but at a hugely inflated cost. It would cost us a lot less, all of us, if we had a single-payer system and paid a little bit each paycheck so that everyone could have the health care they need on a regular basis when problems are small. So telling people to go to the emergency room if they're sick is the most short-sighted, most fiscally irresponsible concept known to man when it comes to health care. And which is, of course, the reason that the GOP fully endorses it.